Hey everybody, it's Kevin Anderson, your host for the Ask the Educator podcast, and with me, my partner Adam Okada. And on this episode, we are following up a international webinar that we did with our very own Dyan Darga. She is new to the team, new-ish to the team, and she did her first international webinar, and now she's on her first official podcast. So. Diane, welcome to the podcast. Welcome to the show. And
Thank
if you
you.
wouldn't mind, just share a little bit about yourself for those of you out there, um, listeners that don't know Diane.
Okay, sure. Well, thanks for having me, guys. I appreciate it. This will be fun. So a little bit about me. I have been a nurse for 30 plus years, and 20 of those I've spent in endoscopy. The last 10 plus or so, I've been in leadership, management, director, like that kind of role of endoscopy departments. Um, I've We've moved around a good bit with my husband's job, and I've had the opportunity to work in Atlanta as well as Detroit, and Florida as well. But I've worked in about 17 different hospitals. So that has been really helpful in giving me perspective.
Mm.
And it really started my entire interest in why do we do things the way we do them? Because, some things were the same from place to place and other things were completely different. And I'm like, why are we doing this differently? And it kind of
Mm.
got my brain going as to, well, who's telling us what to do? How do we
Mm.
follow these directions? That kind of thing. And so obviously there were different hospitals that were conforming to the standards and some that were not.
Yeah, it's a good
So yeah,
point. They,
as you said,
it's
I'm pretty
always
new.
hit and miss, right?
Oh
Yeah,
yeah, for sure, for sure.
yeah. So we're actually recapping your recent webinar that you did for Healthmark Academy. And if you want to check that out, it is the July 2025 webinar on Healthmark Academy on the drying of endoscopes. But how can drying endoscopes be an issue for endoscopy departments?
Well, I think the biggest thing is the pressure for rapid turnover. I mean, most
Mm.
busy departments, oh my gosh, that's the thing is those doctors they want their scopes immediately as fast as possible. And that's the other thing is they don't a lot of times the doctors have no idea what's going on behind closed doors in the endoscope reprocessing room. So they all they know is that they want to, scope their next orifice. And so
It's
so the
true.
rapid turnover is a huge thing. Of course, the other part to that is that they're very complex design, lots of narrow channels and things that make it difficult to clean them, see inside them, and dry them. And so that, and then also there's a um, who are using damaged endoscopes and don't know it. They don't know that they're using damaged endoscopes, but they are, and then that puts them at risk for increased bioburden accumulation, which puts them at risk for difficulties drying, and so on and so forth. It's just like yeah, it just goes down the line.
Yeah, it's a vicious cycle.
So,
And that's,
yeah.
exactly, it's so relatable because I don't know if you know this, Diane, but I used to do a lot of endoscopy procedures as well. I worked in the OR, but I did flexible endoscopes as well. And
Okay.
um, yeah, the pressure on an endoscopy department to get all those I mean, it wasn't unusual for us to have 20 endoscopy procedures in a single room, and we had
Uh-huh.
3 rooms. So we could
Yep.
have anywhere between 40
Yep.
and 65 with add-ons and all of this
Yep.
stuff, and 3 doctors going hard,
Yep.
all day long. And in the reprocessing area, you got this tiny little closet of a reprocessing area, which becomes a bottleneck very quickly, especially when you start adding steps. But
Absolutely.
what people forget is that we add the steps because we learn from people like Ofsted and different studies that, hey, drying is a real issue. Drying
Mm-hmm.
lead
Mm-hmm.
or moisture in the endoscope is a real issue and leads to, the accumulation of bioburden and biofilms and
Yep.
all of this stuff. So um, all that being said, I can relate to what you're saying and some of the things that you went over in your webinar. Like, what do you see you've been to all these different facilities and you're still traveling to different facilities as a part of
Mhm.
our team. What do you see as some of the factors that contribute to moisture left in the endoscopes?
Yeah, so the design, being those narrow channels and everything like that, make it really, really difficult to dry them, especially using the traditional methods, like the AER purge cycle or alcohol flushes or drip and dry, like that kind of thing. I mean, those do not work, and we know that now. Um, so there, we need to step it up, and we need to definitely be doing something different. And yeah, the damage on the inside act as, any little scratch or dent or anything in there acts like a reservoir for these bacteria to kind of glom on and then, make babies. And it just gets bigger and bigger and bigger. And then there's bioburden. That's what that is basically. And that's really, really, really hard to remove. So, and then of course, bioburden leads to difficulties in drying. So yeah, like you say, it's a vicious cycle and you're just kind of going around and around.
Yeah, and Kevin mentioned something else that you talked about during the webinar, which was a number of studies that have been done on endoscopes. Can you talk about some of those studies or some of the research that you looked into about how complex drying endoscopes can be?
Oh, yeah, sure. So the first study, really the foundational study, was Michelle Alpha and Sitter in 1991. So that's 34 years ago. And we knew back then from their study that AER purge cycles don't work. We know that the 10 minutes of active and continuous drying does work. So it's just kind of astounding to me that a whole 34 years later, like we're
Mhm.
just kind of starting to figure this out and putting processes into place that will, prevent this from happening, and do the drying well. So that was definitely the foundational study, and that was huge. But of course, there's been lots of other studies done by different people who some have stripped down the endoscope so that all you can see, like all of the channels in there, are clear channels, so that you can see the moisture and things that way.
Mhm.
Then there's other studies where they're using a borescope to look at the moisture inside the scopes, or drying cards or tape to check for residual moisture. So these studies all kind of attack it from a different angle,
Mhm.
but there's so much research out there, um, you know, just talking about how important it is. And, just the repeating the 10 minutes, the 10 minutes, the 10 minutes, and it's a minimum of 10 minutes. And
Yeah.
really, all of these standards organizations are now recommending that, like unanimously.
Yeah, and usually that happens when there is evidence. So all that stuff, it's funny that you mentioned the alpha study being that old, because thinking about it, I didn't even realize it was that old. And there are so
Yeah,
many things like that in our industry where the practice doesn't keep up with the research sometimes. And it
right.
change is hard, change is
Yeah,
difficult. We're used to using the same scope 5 or 6 times in a day, and
yeah,
it's hard to get your mind wrapped around like, okay, if we have to dry for 10 minutes as a minimum,
yeah,
that means I'm going to need a lot more scopes, or I'm going to need to schedule less cases, or
yes,
whatever. I mean, I remember when this came about, and people were first starting to talk about it, and they were like, so do we have to dry them even if they're going right back into a procedure room? Or is it only if they're going to go into storage and sit and hang and all of that stuff?
right,
And of course,
right.
the idea is that they get dried. That's just part of the procedure. But
Yep,
that's the way of thinking. And so one of the biggest things that I think we can do to try and help people, obviously, upping your game in terms of your scope inventory is a big piece of it. But are there any other practical solutions or even product solutions that can help people with the endoscope drying problem? I mean, this is a real big issue
yeah,
for managing our scopes, and getting things implemented and practices in place is a huge hurdle. So, what do you think
sure.
people could do to try and help this practice gain traction and get implemented?
Right. So I think the best thing is the drying machines. The drying machines to me are the most the least expensive way of doing it. It's usually under capital, and some can dry two scopes at once. So if you get a couple of those going, that really helps with your flow and helps with the turnover time. But then of course drying cabinets are also,
Mhm.
that's really the ideal. Um, but those are very expensive. So a lot of places just don't have that. And then, as I've said, minimally, you need that HEPA filtration and active airflow inside the cabinets. And even if you have that, you're supposed to be doing, or less than that. If you don't have that, you need to be
Mhm.
doing drying verification measures to check and see if your scopes are getting dry. Because we know that if they're not getting dry, if there's even a single drop of moisture inside, that bacteria is multiplying exponentially, and you will have bioburden in your scopes. And that's what's so hard to get out, even with repeated cycles of HLD. Um, and we know right now that hanging in people's cabinets, based on one of the Ofsted studies, that 58 to 71% of scopes hanging in closets right now have bacteria or mold in them after HLD or sterilization. And so to me, that is just so, oh my, like scary.
Mhm.
And, you've just got to realize the importance of getting this completely dry just to protect our patients.
Yeah, for sure. And I mean, it is, Corey stuff is always scary. And, I think that there's so many sobering statistics out there on endoscopes, and specifically the moisture that's left inside endoscopes. And if you are interested, that webinar really goes into great detail about the problem and, how it happens and what we can do about it. So go check out Dyan's webinar on the Academy website. But Dyan, do you have any final thoughts for the listeners on this topic?
Just again, how important it is to dry your scopes. And I know when I was a manager, not so very long ago, what, 6 months ago, I was in
Mhm.
this role and responsible for departments. And when I was a manager, you don't have time to pour over all of the peer-reviewed research and all of this stuff. I mean, I did my best to keep up with the standards and, being connected to SGNA and other professional societies that would help keep me abreast of the latest and greatest. But there's a lot of managers out there who, A, are not doing that, and B, really struggle to find the time to prioritize it, right? So
Mhm.
I feel like a lot of people out there don't really understand the why. Like I did have drying machines and I did eventually get drying cabinets. Yay, that was awesome. But a lot of people and managers don't know. There's a lot of managers who are, used to manage ORs or they're good at managing, but they don't necessarily know endo. And it's so critical to know what the what the recommendations, what the standards are, so that you can try to be in compliance. It's never been more important than it is right now.
Yeah, and that's why we do what we do and why we do all this education, try to make it easy and accessible for people who are busy in the department. So, for all the listeners out there, we appreciate you tuning in and hopefully you take the opportunity to share this stuff with your peers and make sure that people are equipped to learn about this stuff and then bring it back to their administrators, their IPs, get people all kind of rowing in the same direction. That's why we do
Absolutely.
this. And, so nobody has to do it on their own and by themselves. And so, Dyan, again, great job today. Great job on the
Thank you.
webinar. We appreciate you sitting in and doing the show with us.
Absolutely. Anytime, guys. Thank you so much for having me.